All right, so we'll go ahead and get started. Welcome everyone, and thank you for joining us today for today's webinar. My name is Vanessa Reyes, and I am a Health Education Assistant here at San Joaquin County Public Health Services. Today, we will be presenting on our newest resource, the Safe Sleep San Joaquin Toolkit, presented by myself and Maria Robosky Herrera, who is a Senior Public Health Nurse here at San Joaquin County. This toolkit was made possible by the funding provided by the California Department of Public Health, Safe and Active Community STAN, the Kids Place program, and the support of the Safe Kids San Joaquin County Coalition members. Before we get started, I will just go over a little housekeeping. You will all be muted during this webinar. If you have any questions throughout the presentation, please type them into the question box in your control panel. We will also go over any questions at the end of the presentation and open lines for you to ask questions as well. So now, without further ado, we will begin. So the Safe Sleep San Joaquin County Toolkit is our initiative to educate parents and caregivers of infants up to 1 year of age, as well as expectant parents with information they need to keep their babies safe while sleeping. The overall goal of this toolkit is to provide families with the resource to create a safe sleeping environment and prevent sleep-related injuries and deaths. Families who do not have a safe sleep environment and cannot afford one will be able to be referred to one of our MCAH programs and receive a safe sleep education as well as a free portable crib on a limited basis. The two programs that a family may be referred to are the Nurse Home Visitation Program and Black Infant Health. For the Nurse Home Visitation Program, a public health nurse visits a pregnant woman and parents with infants in order to provide education, information, assessments, and offers care coordination. The Black Infant Health Program is a program for women that identify as African American who are less than 30 weeks pregnant and over 18 years old. The program works to develop life skills and improve the overall health and wellness using a culturally centered group-based approach. This toolkit is available on our San Joaquin County Public Health website under the Healthy Lifestyle Program tab. These resources are also available in English and in Spanish. To help promote safe sleep with your clients or patients, we have developed a series of materials. We have developed a brochure which provides an overview of how to keep babies safe, as well as providing an overview of the different types of sleep areas, which we will go over in our presentation. This brochure also gives an overview of the MCAH programs that families can be referred to, as well as the safe sleep practices to follow. We do have these available in print. If you would like them, you can go ahead and reach out to us. And the next material on our toolkit include a frequently asked question sheet, which includes the most common questions asked about infant safety from parents. We also have a poster that can be placed in waiting areas, offices, and public gatherings to promote keeping babies safe while they sleep. There is also an information sheet for grandparents, since we do see that it is common for grandparents to care for their grandchildren, and we believe this resource would be beneficiary. Along with all of these materials, we have available a PowerPoint presentation that your agency can use to educate parents on safe sleep. Maria and I will go over this PowerPoint with you all today. But before we do that, we have a pre-quiz to see how much you know about safe sleep. You can either jot these questions down on a piece of paper or use the chat box to give us your answers. We'll spend about 10 seconds on each question. And so here we go. The first question, what is the leading cause of death for babies between 1 month to 1 year old in the United States? So these are your options. All right, I'll go ahead and move to the next one. The safest way to prepare a crib is by placing soft pillows, blankets, and bumper pads in it. True or false? Next question. Babies should be placed on a blank mattress. Next one. If you don't have a crib or bassinet, it is also safe for your baby to sleep in a swing, bouncer, car seat, or rock-in place. True or false? Sleep-related deaths include all of the following except next. About 90% of kids' deaths occur in the first 6 months of life. True or false? And what is the safest position to place a baby to sleep? Next one. Supervised tummy time includes allowing your baby to sleep on their stomach. True or false? And the last question. Safe sleeping environments lower the risk of infant sleep-related death. True or false? All right, so that were the questions for our pre-quiz. So now we will revisit these questions at the end, and now I will turn this microphone over to Maria to start our safety presentation.
Okay, can you hear me okay? Thank you so much, Vanessa. So my name is Maria Rabowski Herrera. I am the Senior Public Health Nurse with the Maternal Child Adolescent Health Program of San Joaquin County Public Health Services. I supervise the Nurse Home Visiting Program. Thank you all again so much for joining us today. In the state of California, all sudden unexpected infant deaths are reported to the Public Health Department. By law, the Health Department has 3 days to reach out to the family to offer resources and grief support services. Our public health nurses offer a home visit appointment to connect these families to grief counseling or therapy, explain the autopsy process, assist with funeral arrangements if needed, answer their questions about SIDS or other possible outcomes of the autopsy, and offer any other relevant information or resources. I have been providing these types of visits to families who have experienced an infant death for almost 6 years. So we are so excited to bring you our Safe Sleep San Joaquin Toolkit for all of you to share this information in our community. My goal for today is that by the end of this presentation, you will be able to describe different types of sleep-related deaths, sleeping practices, products, and environments that are unsafe because they increase the risk of infant death, and what experts and doctors recommend doing to keep your baby safe during sleep. When a seemingly healthy infant dies suddenly and unexpectedly, it is first labeled a presumed SIDS, and the autopsy will take several months to complete, and the final autopsy report may conclude one of these official causes of death. Sudden infant death syndrome, or SIDS, is defined as the sudden death of an infant less than 1 year of age that cannot be explained after a thorough investigation, including a complete autopsy, examination of the death scene, and a review of the clinical history. The medical examiner may also choose to label it unknown or undetermined. This is when the medical examiner cannot say for sure what caused the death in their medical opinion due to one or more competing manners of death when all available information is considered, including the scene investigation, autopsy, and full medical history. These two things might seem similar, but subtle factors may affect the medical examiner's decision on what to label each death, depending on the circumstances and evidence. There's also slight differences in medical examiners' trainings and school of thought, so some will prefer to use SIDS more often, whereas other medical examiners may prefer to use undetermined more often. Another option is to definitively say that the death was caused by suffocation. Different types of sleep-related suffocation include suffocation by soft bedding, for example, when a pillow or blanket covers an infant's mouth and nose. Overlay, which is when another person rolls on top of the baby. Wedging or entrapment is when an infant gets stuck between two objects such as the mattress and the wall. Strangulation can happen if an infant's head and neck become caught between crib railings from outdated cribs that the railings were too wide on. It could also happen from something like a cord from the window blinds that the baby was able to reach and get tangled in, a cord from a baby monitor, or anything else wrapped around the baby's neck. Later in this presentation, we will be talking a little bit more about positional asphyxia. This is a suffocation due to the baby's body and neck positions closing their airway when the chin is resting on the chest during sleep. And keep in mind that many times after an autopsy is complete, a specific cause of death is found, such as an illness or infection, could be a brain abnormality, a seizure disorder, a heart defect, metabolic disorder, or many other medical conditions. This graph from 2017 shows the breakdown of the percentages of various sleep-related deaths in the United States, not including the cases where another cause of death was found. So now we have a better understanding of the different types of sleep-related deaths. However, it's important to help families understand that the recommendations for preventing all of them are the same advice. Even if a baby is not truly suffocating, various sleep positions and surfaces cause babies to receive less oxygen, which contributes to SIDS, even if their face was not fully blocked. So why is this important? Over 3,600 babies in the United States die suddenly and unexpectedly in their sleep each year. In San Joaquin County, about 5 to 6 babies die suddenly and unexpectedly in their sleep each year locally. So in America in 2017, in just 1 year, there were 1,400 SIDS deaths and over 900 accidental suffocation strangulation deaths in the United States. Here is a graph from our local epidemiology team that shows causes of sleep-related deaths in the last 10 years here in San Joaquin County. Blue being suffocation, red being SIDS, and purple being undetermined. This year, in 2019, we have had an increase in the number of presumed SIDS cases, more than we usually do, but we do not have the final causes of death on those cases yet. So some of the most important facts to keep in mind about sudden infant death syndrome. This is the number one leading cause of death for babies in the United States over 1 month old. It is the fourth leading cause of death overall from the day they're born, after birth defects, prematurity, and complications of pregnancy. Most SIDS deaths occur between 1 month to 4 months of age, and 90% happen before 6 months. Older babies have slightly higher rates of suffocation due to moving around more in their sleep and rolling into unsafe things like pillows and blankets. So this information comes from the CDC as well as the American Academy of Pediatrics and has been repeatedly demonstrated in many research studies. So what can we do to help? Place all babies to sleep safely. Follow guidelines made by experts and doctors that have been shown to lower the risk of sleep-related death. These are the guidelines we are reviewing in this presentation. And teach our friends, family, and caregivers about safe sleep, because 1 in 5 SIDS deaths occurs while the baby is being cared for by someone other than the parent. Vanessa, why don't you tell us about the ABCs of safe sleep?
Absolutely. Thank you, Maria. So the ABCs is the easiest way to remember and promote safe sleep. ABC stands for alone, back, and in a crib. So alone. Babies are safest when they sleep alone in their own sleep surface. Babies are at higher risk of death when sharing a bed with anyone. This includes other children, siblings, adults, and parents. When placing a baby down, we want to make sure there are no pillows, blankets, blue sheets, or any other accessory that can suffocate the child while they sleep. Next is C for back. Placing a baby on their back is the safest position for sleeping during every nap time and at nighttime. It is okay if the child rolls over once they are sleeping, but we always want to start by placing the baby on their back. And C is for crib. Cribs and bassinets are the safest places for a baby to sleep. There should be nothing inside except a firm mattress with a fitted sheet.
Thank you, Vanessa. So let's talk a little bit more about the different types of safe sleep areas. A bassinet is a small bed specifically for babies from birth until they reach about 15 to 20 pounds, depending on the manufacturer. Check your label to see the maximum weight and height restrictions for your specific bassinet. This is usually by about 4 months old that babies outgrow them. A crib is a large baby bed which can be used for several years. It has railing spaces no more than 2 3/8 inches apart. This means that a can of soda cannot fit through the spacing. And mesh fabric side panels. And you will also need to check the maximum weight and height restrictions on these, but most can be used for a few years. And this is what will be available if you refer anyone to our nurse home visiting or Black Infant Health program. If they do not have a safe sleep environment for their baby, we are able to provide them with one for free on a limited basis. More about unsafe sleep positions. So I just want to give you guys a little bit more detail about belly sleeping. So babies should be placed to sleep on their back for every sleep time, as Vanessa said. Once they are old enough to roll over in their sleep, there is no evidence that you need to turn them back over on their back. Usually their brain and muscles have developed enough to avoid tummy sleeping related deaths at this age, but small babies, especially those under 6 months, are at high risk of death from tummy sleeping. When babies sleep on their belly, this can cause rebreathing of carbon dioxide and lower oxygen levels. Small babies might not have enough strength to push their face away from soft surfaces. While it is true that tummy sleeping may cause longer, deeper sleep, research shows that longer, deeper sleep is associated with more cases of SIDS. Waking up often at night is normal and healthy, and parents should be assured that frequent waking at night is associated with a lower risk of sleep-related death, even if it does cause the parents to be exhausted. Assure parents that babies will sleep through the night when they are biologically and developmentally ready to do so. Assure parents that most babies sleep longer after 4 to 6 months and a lot better after 1 year old. The exhaustion is temporary. Please do not put babies on their belly in order to help them sleep longer. Also keep in mind that when babies who usually sleep on their back sleep on their tummy for the very first time, the risk of death is much higher. They are not used to sleeping on their belly and seem to get into dangerous positions very easily during the first tummy sleep. When babies sleep on their tummy on top of loose blankets or an adult bed, the risk of death is much higher. So what about side sleeping? Side sleeping babies usually roll onto their stomachs, and this is not recommended. Then parents might prop them up using things like pillows or rolled up blankets to prop them up and causing an even more unsafe sleep environment. So even when babies can roll over on their own, they should always be placed on their backs to sleep. A common question that many parents ask is, will my baby choke on spit up in their sleep? Research does not show that babies are dying from spit up in their sleep. If that were the case, this would be easily seen on autopsy if the baby had aspirated. We are not seeing babies dying from choking on spit up, but we are seeing many sleep-related deaths. Parents often misunderstand choking versus normal coughing or gagging, which is evidence of a normal protective gag reflex. So let's look at this photo of the baby's anatomy when sleeping on their stomach. When a baby spits up or vomits from the esophagus, the tube that goes into your stomach, gravity can actually cause the spit up to drip into the trachea, the breathing tube, and this can cause a baby to choke. However, when babies are placed on their backs to sleep, they're at decreased risk of choking, and research has confirmed there is no increased risk of death due to choking while back sleeping. Now look at the baby sleeping on their back. When the baby spits up from the esophagus, gravity guides the residual spit up back down the esophagus. When babies spit up while laying on their back, we usually see the spit up flow out of the side of the mouth, or the baby is able to swallow it back down, even if there is some coughing or gagging. Also, if the parents are sleeping in the same room as the baby, parents almost always wake up to the sounds of these noises and pick their baby up. While this can be really scary for parents, assure them that the risk of SIDS is much higher than any known risk from death due to spit up. If a parent is concerned about their baby spitting up often or having severe reflux, talk to your doctor and ask them how to help baby through this. Explain to parents that the risk of choking due to reflux is much lower than the risk of death due to SIDS. Evidence shows that elevating the head of the bed for reflux is not very effective. However, some doctors do still recommend this. I tell families that I will never tell them to disregard their doctor's advice, but I can let them know about the research showing this practice to be not effective and quite dangerous because the baby may slide down and get into a dangerous position. Parents can also ask their doctor about the possibility of medication for severe reflux instead of elevating the bed. So some doctors may rarely recommend belly sleeping or elevating the baby's head in some specific serious upper airway disorders, such as birth defects of the throat, but not for normal healthy babies. Let's talk more about unsafe sleep positions and the term positional asphyxia. For those of you who have ever taken a CPR class, what is the first thing you do to a person's chin before giving them rescue breath? You tilt the chin back, right? Why? In order to open the airway. When a baby's chin rests on their chest during sleep, this narrows the airway or closes it entirely, lowers oxygen, and strongly increases the risk of death due to positional asphyxia. For this reason, babies should never sleep in things like bouncers, swings, pillows, rock and plays, dock-a-tots, or even car seats. Many infant deaths have occurred while sleeping in these products. What about babies sleeping in the car? Well, when you install the car seats correctly, the car seat is perfectly angled and tilted back to prevent this chin-to-chest position, and they often have a base to help the car seat tilt in the right way. This is why very small babies are required to pass something called the car seat test or car seat challenge before hospital discharge to ensure that they can ride safely in the car seat and not drop their chin to their chest. The problem becomes when people take the sleeping baby in the car seat out of the car and put it on the floor. It is no longer tilted back at the right angle and can cause death from positional asphyxia. Babies should never nap in car seats that are not in the car. And if your baby's chin keeps falling to their chest even in the car, your car seat might not be correctly installed and need a wedge or a towel underneath to get the correct tilt angle. See your local child passenger safety technician for further questions. And we have technicians available at Public Health if you need one. Unsafe sleep products. So this includes car seats, swings, slings, bouncers, strollers. And just so you know, of all of the deaths in car seats, about half were from strangulation due to loose car seat straps. People let their babies nap in the car seat at home and figured since they weren't driving, they didn't need to buckle the straps. And many times that caused baby to get tangled and caught in the straps, causing suffocation. So in just 4 years, one study showed 47 deaths in these types of products. There have also been injuries from falls. For example, when people put car seats on top of a kitchen counter or a table. And there have also been times when people put a car seat on a couch or a bed and it rolled over, causing suffocation. Young babies have also died in carriers due to baby wearing. Baby wearing is great, but when you're doing so, make sure that the baby's head is up and above the fabric, the face is always visible, and the nose and mouth are clear of any obstructions. But look at these babies. They look so cozy and comfy. It can be really hard to tell parents that they are doing something unsafe or harmful when their child looks so happy and peaceful. But do remind parents that using these products is linked to infant death. It's somewhat rare, but it's one of the leading causes of infant death. And yes, other parents might say that they did it and their kids are fine. But what about the 3,600 babies each year who were fine until one night they weren't fine anymore and they were found cold and blue? You should never place your baby to sleep on any couch, sofa, armchair, beanbag, or waterbed. These extra soft surfaces have the highest rates of infant death and have been shown to increase the risk of death by about 18 times. Oftentimes parents will say, "Oh, I'm watching them." But keep in mind, if you go use the restroom for a few minutes, or you fall asleep on the couch or get distracted by your phone or TV, that could be enough time for the baby to suffocate. The risk of death is especially high when you sleep together with your baby on one of these surfaces and is never recommended. A few more ways to reduce the risk of sleep-related death. Babies of mothers who smoke are 2 to 3 times more likely to die of SIDS. If a mother smokes at any time during the pregnancy and then quit, that's great, but keep in mind that her baby is still at a higher risk of SIDS due to prenatal exposure of nicotine on the brain compared to the baby that was not prenatally exposed. Keep your baby away from secondhand and third-hand smoke. Most people have heard of secondhand, but if you haven't heard of third-hand smoke, this is the residue that's left behind on the skin, clothes, and hair after a person smokes. The third-hand smoke has been shown to increase the risk of SIDS, ear infections, asthma, allergies, and more frequent colds in babies. So ask anyone who smokes to wash their hands and face and change their jacket or shirt before holding your baby. Avoid swaddling. So swaddling is a very popular practice and may help some newborns sleep a little longer, but we now know that it comes with risks. Longer, deeper sleep increases the risk of SIDS. Swaddles can become loose and undone and suffocate the baby, and they can also cause overheating. Babies might also roll over and not be able to use their arms to protect themselves from suffocation. Studies have also shown that when babies' legs are straight and swaddled too tightly, it can cause serious hip joint issues. Swaddling is not recommended due to these risks. I know it's often seen in the hospital. It's also very frequently used for babies who are withdrawing from drugs as well. So this is something that should be discussed with the doctor, but keep in mind that in general, swaddling is not recommended due to these risks. Avoid overheating. Do not overdress the baby. Maximum 1 more layer than the adult. Your room should be comfortable for an adult in a short-sleeved shirt, about somewhere between 65 to 70 degrees. Use breathable cotton fabric. Do not use blankets on top or underneath the baby. So I know it might seem confusing when we say dress the baby warm, but don't overdress them. So you want them dressed warm enough to be able to sleep without a blanket, but not so hot that they're sweaty, they have wet hair, they're breathing fast, their cheeks might be red. So yes, sometimes babies sweat, but if you're seeing sweating with every sleep time, you might be overdressing them. I have seen many families put 4, 5 layers of clothing on babies. So a great suggestion is to consider using a sleep sack, as you see in the bottom picture. This is also called a wearable blanket. They're widely available in stores and online, not too expensive. And basically, as the baby rolls around in their sleep, the blanket stays on them, preventing suffocation. Also keep in mind that, just one more thing, that wearing a hat during sleep has been shown to increase the risk of SIDS by 7 times, and a baby should never sleep with a hat on. I don't know, unless you're maybe camping outside in the very freezing cold, but if your baby is sleeping indoors, they should not be sleeping with a hat on. Avoid bed sharing. Experts recommend room sharing, but not bed sharing. Bed sharing increases the risk of infant death due to pillows and bedding, the possibility of rolling over on the baby, entrapment between the bed and wall, the mattress being too soft, and heavy blankets which can cause overheating. I know this is a somewhat controversial debate. There are many parents who advocate that they love bed sharing and it works great for their family, and certainly I hear many people doing this. But when having that conversation, again, we just really want to remind them that the baby is at higher risk of infant death when bed sharing, and therefore it is not recommended. So a couple of things I want to mention is that in most bed sharing cases, if these factors on this slide are present, there is a much, much, much higher risk of death. So bed sharing is incredibly dangerous when, I'll go through these briefly. The sleep surface is a couch, sofa, chair, waterbed, or beanbag. If any adult in the bed is a smoker, if the baby's mother smoked at any time during the pregnancy, if the baby was born premature or under 5.5 pounds, when another child is in the bed, especially a toddler, when the baby is less than 4 months old, when there are pillows and blankets near the baby, if any adult in the bed has been drinking alcohol, taking drugs, or any medications that make them extra sleepy. Yes, all parents are exhausted, but when you really feel like maybe you only have 3 hours of sleep and you're excessively tired that night. And in general, the risk is higher when any other adult is in the bed besides the mother. But one of the biggest ones is definitely drinking alcohol and bed sharing, any adult being a smoker and bed sharing, well, all of these really. If any of these factors are true about the baby or the parent, bed sharing is very strongly not recommended. Not recommended in general, but keep in mind that these factors greatly increase the risk of death. So some other final pieces of advice that have also been proven to reduce the risk of sleep-related death. Do breastfeed. Breastfed babies have a significantly lower risk of SIDS. Breastfeeding for at least 2 months lowers the risk of SIDS in half, even if partially breastfeeding. So some formula and some breast milk is still protective against SIDS. There is stronger protection with longer and exclusive breastfeeding. So we know that new moms don't get enough sleep and are exhausted, and anybody that has breastfed a baby knows that when you start breastfeeding, the mother's brain releases powerful chemicals and hormones, which make you very relaxed and very sleepy. So we recommend to try to make sure to have a partner or family member check on you to make sure that you don't fall asleep while feeding the baby in an unsafe environment or unsafe position. We know that many moms will fall asleep breastfeeding in a recliner or chair, and this can be very unsafe. You might want to consider setting an alarm on your phone or try to stay distracted with Facebook, but do make sure that you're not falling asleep while breastfeeding in an unsafe environment or unsafe position. Vanessa, why don't you tell us a few other things that may reduce the risk of SIDS?
Absolutely. So the next item on our list is do offer tummy time while the baby is awake and supervised. So tummy time helps babies develop strong muscles in their necks, backs, and shoulders. We want to make sure that the babies get some tummy time each day starting from birth. Newborns can start on their parents' chest or lap until they are a few weeks old. After that, they can be placed on their tummy on a flat, solid surface like the floor. We want to remember that we use our back to sleep and tummy to play. The next do is do offer a pacifier. So research has shown that babies who took a pacifier during sleep are less likely to die from SIDS. It's unclear why, but maybe it's the action of sucking that keeps the baby's brain more active during sleep. We do want to advise that introducing a pacifier too early may negatively affect breastfeeding success. So we want to wait until the baby is breastfeeding well to introduce a pacifier. The next do, as Maria had mentioned, is do room share. We encourage and recommend room sharing for 1 year and especially recommended for at least for 6 months. Remember, room share, not bed share. And next, we have a small little activity. You can either chime in the chat box, but I will go over these 4 pictures, and you can identify what is wrong with these sleep areas. So I'll give you a minute or so just to kind of chime into the chat to see what you identify as being wrong with these sleep areas. Anyone wants to chat anything? But I'll just kind of go over each picture now. So in the first picture, up at the top, we see that the baby is covered in blankets. There is pillows above him and kind of you see going around, as well as bumper pads and a lot of stuffed animals. So to create this a safe sleeping environment, you would need to remove all of these items and just make sure that the baby is there with a fitted sheet. In this next picture, we see that the dad is bed sharing. The baby is on his side. The blanket is on top and underneath the baby. And the dad's arm could easily crush the baby, so he cannot move his chest enough to breathe. And in this next picture over here, we see that the baby is sleeping in a car seat with the chin resting on his chest. We also see that the belt buckle is not in the correct position. We want to make sure that the buckle of the car seat is placed between the armpit and is at armpit level. And in this last picture, we see that there are blankets, stuffed animals, bumper pads, and the baby is sleeping on his side. So we would want to make sure that we remove all of these objects when placing the baby to sleep. So I'll hand it back to you, Maria.
So just some final thoughts as you're talking to your families about those first few months of sleepless nights. Do remind parents that waking up often is normal and healthy for babies. This is temporary, and it will get better soon. Babies have several growth spurts in their brain development, which changes their brain waves and sleep patterns, and their sleep patterns will get better and worse and better and worse, and this is completely normal. Do not start unsafe sleeping habits. Instead, ask for help. Talk to doctors and other experts about ways to help your baby sleep better, but safely. Again, this can be a difficult subject with parents because I'm often met with arguments like, well, I've always done this with all of my kids and they're fine. This is what works for my family. So you don't want to come off as what you're doing is dangerous and wrong and terrible and you're a horrible parent. So try to state your recommendations in a way that, I'm just reminding you that this has been shown to increase the risk of infant death. And the reason this presentation is so long is to give you an insight into all of the different factors that influence sleep-related death. So by using this information, hopefully families are empowered to make the best but safest choice that's right for their family. So now we're going to go ahead and go through the answers. All right. The leading cause of death for babies between 1 month to 1 year old. This was this. Okay. The safest way to prepare a crib is by placing soft pillows, blankets, and bumper pads in it. This is false. The opposite of what we want to do. Babies should be placed to sleep on a firm mattress. If you do not have a crib or bassinet, false, it is not safe for your baby to sleep in a swing, bouncer, car seat, or rock and play. And just a reminder, rock and plays were recently recalled due to high incidence of infant death. Sleep-related deaths include all of the following except head injury from falling off the bed. Kind of seems sleep-related, but not classified as a sleep-related death. Okay, whereas overheating is something that contributes to sleep-related death. About 90% of SIDS deaths occur in the first 6 months of life. This is true. Okay, but it can still happen up to 12 months. The safest position to place a baby to sleep is on their back. ABCs. Supervised tummy time includes allowing baby to sleep on their stomach. False. Supervised tummy time includes awake playing time on their tummy. Safe sleeping environments lower the risk of infant sleep-related death. This is true. To share the information, teach your family and friends the ABCs of safe sleep. Alone, on the back, and in a crib. There's a few resources for you from the CDC, the American Academy of Pediatrics, National Institute of Health, and there's a huge variety of safe sleep resources available online, obviously, as well as our toolkit. These were the main references we used for the presentation. So the American Academy of Pediatrics Task Force on Sudden Infant Death Syndrome published a literature review, like a 50-page document, and this technical report includes over 400 different research studies that they have made their guidelines and recommendations from. And you can always contact maternal, child, adolescent health for any further questions that you have. And I believe that's the end of our presentation. Why don't we go ahead and unmute everybody in case you would like to ask questions over the phone. And I haven't seen any questions in the chat box yet, so you can also chat them or ask them over the phone. And maybe if we can figure it out, I would love to try to go to our website maybe and show you guys how to access that link. If we can. Let me check. Okay. So I believe everybody is unmuted. So if you could please use your own mute button if you're not talking. Okay. Does anybody have any questions for myself or Vanessa? Let me show you on our website. So this is sjc.phs.org. And on the left-hand side, there's Healthy Lifestyle Program. Okay, it's going to be under Injury Prevention here. So here's the Safe Sleep Toolkit. Right now, the only thing that's missing is the PowerPoint, which we hope to get uploaded later today. And then we are just working on translating this PowerPoint into Spanish, which will also be available soon. But here are the materials Vanessa mentioned at the beginning of the presentation. So you may print these out at your organization. The only thing that we would like to request, if you do end up using our Safe Sleep Toolkit online to present this information to your families or your clients, or your staff even, we would like to know about it. So we've actually developed a form that we're going to put up on right here on the website as well. And it's just basically saying, this is our organization. We have 30 people. We presented to our staff because we are trying to keep track for the grant how many agencies are using our Safe Sleep Toolkit on our website. Any other questions or comments on any safe sleep related topic? We've still got about 10-15 minutes. I just want to make sure we're not having any technical assistance problems, right? Are people able to use the chat box? Are people able to speak if they want to? All right, last chance. Any questions from anybody on any topic? Well, I think professionally, I have read, a few studies that show that it can be detrimental, but it really, really depends on the way you do it and the age that you do it. So I would say it certainly is a personal decision for each family, but we know that we don't want to let the child cry for a prolonged amount of time, especially if they're under 1 year old. When they're a toddler or they're a little older, they might understand more that, I can cry to get my way. But we know that when young babies spend a long amount of time crying, it raises cortisol levels and stress levels, and has been linked to some negative outcomes. So I would say it's still a very much a personal decision, but through my research as a nurse, I have heard of it do some harm. What is being done to educate hospital staff about swaddling babies? We had a question come in. So I believe each hospital has their own education department that kind of tackles this. I am not aware of the details of those specifics. So maybe moving forward, in our work, we can reach out to more hospitals to talk about swaddling. And again, I would say the biggest thing with swaddling is that it's one thing if you are fully awake and staring at your baby and cuddling them, and but if you are asleep or distracted, that's when it can become unsafe. So thank you for that. We will consider reaching out to more hospitals to talk about swaddling. Any other questions? Thank you, guys. I just want to thank you all so much for joining us today. Vanessa, is there anything else you have to add?
No, that is all. So just great, and thank you, everyone. We appreciate you being here. And remember to share this information, and remember the ABCs of safe sleep. So with that, we will end our webinar here. And we'll also have the recording on our website most likely within the next couple of weeks. So look out for that if there was someone that missed the presentation. So yeah, with that, we hope you guys have a great day and have a great week. So thank you for joining us. Thank you.